Let me explain a rare pregnancy that most people have never heard of. A molar pregnancy is one where abnormal tissue grows in the uterus instead of an actual baby. And there are two types, a complete mole and a partial mole. A complete mole is one that has 100% abnormal tissue. A partial mole is one where there is subabnormal tissue and some tissue from a fetus, but no baby actually develops. And in this video, we'll be looking at a complete mole. A molar pregnancy presents with vaginal bleeding and pelvic pain. And to cover some basics, females have 46 chromosomes and they are XX. Males have 46 chromosomes, but males are XY. And what normally happens is that the sperm gives 23 chromosomes and an X or a Y, and the egg gives 23 chromosomes and an X. So if the male gives a 23 chromosomes and an X and the female gives a 23 chromosomes and an X, then the baby will be a female. If the female gives a 23 chromosomes X and the males give 23 chromosome Y, then the baby that forms will be a male. Now in a complete mole, a sperm with 23 chromosomes X fertilizes an empty egg, meaning that the egg does not have the 23X. The egg does not have any genetic material. Now, what farms will have only the father's 23X, and the sperm will duplicate or double its 23X to give 46XX. So what farms only has the father's material, genetic material, and gives a mole abnormal tissue. Now there's another example of a complete mole where two sperm fertilizes an empty egg again. Now sperm 1 can have 23 chromosomes X, and then sperm 2 can have 23 chromosomes X. And what forms has 46XX only with the father's genetic material. Another example with the same two sperm fertilizing an empty egg. Sperm 1 can have 23X, sperm 2 can have 23Y, 23 chromosomes Y, and the egg is empty, no genetic material. So what forms as 46XY? Again, only the father's genetic material. And if this was helpful, stay tuned for part 2, where we'll be looking at partial mole and risk factors for developing molar pregnancies.